muted. Okay. Hey, just as a heads up, thank you for joining us on short notice. Apologies, Scott and I have been trying to get this off the ground for about 2.5 days right now. We've been a little bit under the water along with many of the rest of you. We felt it was important to communicate with you and just give you some quick updates on some information on here. And again, thank you for the short notice. If you have a question or need something, Scott is monitoring the chat window, and please feel free to ask questions, and we'll try to open this up here if we time permitting. But I want you to know it's just Scott and I on the call right now. Most of the EMS office is deployed to multiple locations at this time. So we've got a lot going, just kind of like what you've got going on this. I just briefly wanted to go over just a couple things and some questions that I've received, very good questions, is, you know, how do we see this corona monitor in the WATRS system? And many people have been asking about that. And let me get my agenda back so I can see it. Sorry about that. Oops. I'm trying to take the zoom away. Okay. All right. Many of you have asked, how do I see the coronavirus monitor once I've completed it? And there's just a really easy way. And one thing I'm just going to tell you is this was built in worksheets. You're going to start seeing more and more information on worksheets because they're really nice and easy to build and deploy and make it easy to enter the information. One of the biggest things that is coming out is the office has purchased the Community EMS documentation system, and the Community EMS documentation system works off worksheets. So this was built a number of weeks ago, and we were ready to deploy it in case things blew up, which obviously, if you've watched any of the news recently, it has. So if you feel you've entered the worksheet for the coronavirus, in order to access it, you just come over here, click on your timeline. It will show your timeline up here. You just click this arrow, and it drops you right in there. And then there's just some of the information that you'll see in there. The top section populates off the run form. The next section is just simple yes, no, and answer questions. And I want to tell everybody thank you so much for filling out temperatures. We're starting to see a significant improvement in temperatures coming up. A new section is we're trying to get a score, and I'll show you how that score works off the providers. Unfortunately, I do know I consulted with a number of you that may be on the call. We cannot automate that score at this time. I have tried multiple ways, multiple different patterns, even rebuilds, possibly moving it into another component. Unfortunately, we're just limited by the software at this time. It just doesn't have the ability to automatically populate that. But many of you have seen this. We're getting a fair number of these reports per day. They are helping us with the information on that. Just on the agenda, you saw we're looking at potentially dropping some of the questions. And some of the travel questions, especially going to China or outside the United States, probably will be coming off the list. Just because with all the quarantines, travel restrictions, we're not sure how much longer we're going to keep those up there on that. Okay. Any questions, Scott? Cool. Hi. The coronavirus monitor's been out there for a fair number of days. It was designed so you could easily just answer the questions on there. And we're seeing some really, really good work on that. There is an instruction sheet. I'm going to send out the latest instruction sheet here. Oops, let me move it over here so I can get it. This is kind of going to be version 3. It goes through and gives you the instructions how to put this in, how to access that over on the edges, then monitoring the coronavirus. Comes with the questions, the fever, and that standard demographic type stuff. And at the very last page, just as a heads up, that tells you how to access that timeline. Then in order to click on that, and access the thing. Okay. All right. What's the EMS office doing monitoring this? A significant amount. We're getting pulled a lot of directions at this time. Oops. And I just want to show you, as soon as I get my mouse back over, the scoring mechanism. After this call, I'm going to send out these cards. We've got these cards that scores the questions in that component, so you guys can add that up. Plus, you can do it inside that worksheet. And here's one of the things that, in working with national statisticians and people, what we found is a score of 5 or greater than and less than 8 is probably a moderate risk of being a COVID patient, and the scores greater than 8 are deemed to be or considered to be a higher risk. Now, do we have an exact cutoff when it will be a COVID patient? No. But what we do know is the scores go up, it has a higher indication. Now, there are some challenges with this. I'm going to show you, this is the report that we work on considerably amount. Let me get this, it's not showing as much as I'd like. There. So this is a report that we're doing on a regular basis here at the EMS office. And what we're doing is we're monitoring what the provider's impression is on the patient. And we are monitoring the counties. We just want to see what's going on. And we're really relying on you as the provider to determine, do you feel there's a fever present? Do they have chills? Do they feel warm? Are they taking anti-fever medications? Just to get a little bit more comfort. But I think from what we're looking at, we're seeing some really good information. We're also seeing a significant increase in the number of temperatures. So in coming back to that, we're scoring a high score, or we're scoring a score off is a fever present, which is 2 points. If they have a fever and it's 100.4 and greater, they get 4 points. If they have a cough, they get 4 points. If they have a sore throat, because initially sore throat was one of the indicators, you don't see it as much now from a lot of the symptoms. We went ahead and left that in because if they've been coughing for a few days, they're probably going to have a sore throat. It's just a single point. Are you determining that they have some difficulty breathing? If they do, it's 4 points. If they have a contact with somebody they think that has COVID-19, whether it be a potential, a suspected, or a confirmed, they get some points. As you look, we've got, in this report, there's a score of 18 going down on that. It's just going to give you a risk analysis, and we need to get some feedback from everybody. How's that risk number working for you? Is it giving you some good information? Now, some of the problems with this is we do know that, yeah, if they've got an infection, say for instance they've got a wound that's very infected or a bed sore that's very infected, yeah, that can spark the fever and look up that. At this time, we haven't gone into reducing the points for certain items. We're just mainly trying to focus on getting those higher risk patients and giving you a means where you can monitor that and say, this is a little bit more of a concern. I do know that many of you are taking respiratory protections and sending a single provider into the house prior to accessing with the full crew. And I'm going to compliment many of you on doing that. I don't know how many of all are doing that, but I do know it is a good amount, and we're doing pretty good on that. So that is a score. One of the things that you might want to know is, can I run this same report? Yes. If you go into the report writer, it's been in there for about 3 days. There will be it's what's called the coronavirus monitor, and it's listed as public. You can run the same report. However, the scores aren't in that report because the scores are a matrix that we developed here at the office. If you decide you want to have those scores, get in touch with me. I'll share the spreadsheet with you where you can modify the scores. It takes a couple steps, and it's very easy to make a mistake. in the scores on that when you start copying that over. Okay. Any questions? Hey, we're doing good. Things are going good.
Just not if anybody's admitting to.
Feel free to admit the questions. We're happy to answer them, see what we can come up with on that.
Should we be doing this on every patient or just patients we suspect?
Okay, the question is, should we be doing this on every patient or just the patients you suspect? Our preference is every patient contact, and especially in canceled calls. The best you can get off information, canceled calls. We know that you're going to have a canceled call that there's going to be no patient contact. That's cool. But if you contact a patient, hopefully you can just say, hey, we're just collecting this information. We're doing monitoring our community's health. Would you mind answering some of these questions for me? I do want you to know in another state, they feel from a canceled call that they were able to identify one of the patients that tested positive for the coronavirus. So that's why we're looking at every contact on there. We also are aware, discussed it with one agency where the point score of the patient from the provider's information was only a 4, but then the hospital called back and said, hey, with further information, we're testing for that patient for the COVID-19. And you know, our assumption was putting it together that that provider didn't get all the information from the patient that they gave the emergency room. So this heads up. The concept is every patient, and we're going to try to make this a little bit easier for you, and we're also in need of your feedback on that. I'm going to bring this back over. I'm going to talk. One of the things that's driving us nuts, especially me and many of other administrators of systems like this, is what are we doing for an ICD-10 or for a primary impression for the 3 cases we want to look at? Do we suspect this is COVID-19? Do we think there may be an exposure to a patient with COVID-19? Or this is actually a confirmed patient coming up? I keep saying we're going to deploy the codes for this. However, it's a controversy on the national level what this is going to be. There's approximately right now 9 different ICD-10 codes that could be used. The prevalence out there at this time is repurposing an ICD-10 code in order to monitor it for these 3 items. However, there has not been a very good consensus on the direction it's supposed to go. And yes, the CDC has put out a U code, but we're still not fully in agreement on how to do that. I keep hoping we're going to deploy that. I keep hoping that the discussions will come up. I'm hoping that NHTSA, NEMSIS, and the CDC can agree so we could all use the same monitor for this and then submit it up, then we can get some more national numbers on this. At this time, there is a variety of codes out there, but if we deploy something and then we have to change midstream, I'm a little concerned about that. Okay. That's briefly what we wanted to communicate with folks, although we want you to stay safe out there. And we're happy to accept questions on the chat at this time. And I do want to tell you is we've been trying to put this together, want to get some information out there with a lot of things going. But we wanted to at least give a brief information out on what's going on. I'll also be sending out the updated instructions and the pocket cards to each of the agency administrators right after or shortly after this call. I've had a number of messages come in the meantime, and I'll try to get to everybody as soon as I can priority-wise. So, Scott, how are we doing on the chat?
We're good. I'll unmute everybody, and then people can just ask questions.
Like number.
Okay. So you're all unmuted. If you don't have a question, you'd hit mute on your side of the phone, please. Thank you. And if you have a question, feel free to throw out your questions. If nothing else, Jay will make up answers.
Yeah. Hey, I haven't had a chance to get in touch with all of you, but the directors have given us feedback on the pocket cards and the information. Thank you very much. And it's been our goal to get this out there to you, but this is a very dynamic situation. Even though we think we've got a pretty good idea and handle on it, I bet you it's going to change in some of the information going out.
The other item, too, if you guys and folks and gals and everybody have not heard, if you go to the front page of the EMS office on the COVID header at the top, the bottom item is a link to a Google Drive that we've put together, and it has a bunch of different information in it. Folks have shared protocols, they've shared some best practices. There's links to the federal guidance that's in there, the guidance coming up from us from the OEMS office. And so that's available to you. If you have anything you want to share or have any policies, procedures, protocols, anything that comes out, feel free to email that to me. We can drop it. So it's the COVID-19, go down, Jay. EMS Directors Resource Folder. And if you click on that link, it brings you into a Google Drive, which I have opened up to all of us, and you can get in there and hit these different folders. One of the bigger ones that people have been asked for is a respiratory protection plan for those agencies that don't have it. The one that Jay is on there, this is the sample from Wyoming Workforce Services, available to anybody to use. Also in there's one that Jason Perry and Hewlett put together, and I forget what the other one is. But so feel free. Jason said anybody can use his and modify. Just take out the Hewlett and put in your service if necessary, and then whatever else is in there is public domain at this point in time. So.
Also, I'm just going to show you, there is a prototype of a slideshow that we are working on that's going to be published here shortly. And it just goes through, what we're doing with this slideshow is we're taking the information that you're submitting, either by your impressions or by your symptoms. And since March 1st, and this slideshow is just showing the results of what's happening. There is a map. You can hover over it. You can zoom in a little bit. It gives you, are we treating and transporting patients? So this is directly out of the WATRS. This is with the COVID monitor.
She already died, or?
No, we don't know.
Well, now you see.
Okay.
So this just shows the WATRS cases, not the COVID monitor, just basic, again, off the impressions and the symptoms that you are providing in the system at this time, showing us where we may have some instance on there. Just thought I'd show, this is a prototype that's out there, and the office staff is working on updating this, and we hope to have this published and available for you here at some point in the future. Are they unmuted? Okay. It looks like you're muted because we've got a lot of background noise. If you have any questions, please feel free to put them in the chat. And the most important thing is thank you, everybody, for all your hard work. We know this is a lot of extra work, but we also know that this is important right now because this happens to be the sign of the times, and things are changing dynamically regularly. So questions, fire away on the chat.
We will put the pocket cards and the other items that Jay is going to share. We'll also put those in that folder, so that if it's 2 o'clock in the morning and you want to access them, you can grab them there and not have to rely on one of us being awake or email those out to you if we missed you. But they'll be there as well. So. And again, this playlist is not confirmed cases. This is just based off the information that you all have been putting in WATRS since March 1st. We'll hold for a minute to check for questions. No questions coming in. Just really on behalf of the Office of Emergency Medical Services, the staff down here, we are spread incredibly thin.
well, like I said, I think it's right now Scott and I in the office, and everybody else is on assigned duties, and Jolene is running around making sure everybody's keeping up with their information. So thank you for your patience. Thank you for the information. Feel free to send us questions on that, and we hope to repeat this with a little better information after we get your feedback. I would like to say hopefully by tomorrow afternoon, but we get redirected on a moment's notice on this type of stuff. With no questions, we'll go ahead and end the call, and thank you very much. Stay safe out there.